So I wear the hat of the chair of the Integrative Fertility Symposium Healthy Seminars. Some of you may not know, but I'm also a practitioner. My clinic is in Vancouver, British Columbia, Canada. It's called Acubalance Wellness Center. And I'm regulated there as a doctor of Chinese medicine. And we're the first clinic to focus on reproductive health. And our clinic was responsible for getting acupuncturists in IVF clinics in Vancouver. So I'm going to share with you kind of my approach to polycystic ovarian syndrome that we do at Acubalance. And you should know PCOS is one of the leading causes of ovulatory disorders. And I'm going to share my 19 plus years of experience of treating this ovulatory disorder and using an integrative approach as well. So for your patients to follow your recommendations, they really have to understand the why behind the how. The how is what we're going to ask them to do. Lifestyle changes, going for yoga classes, diet, drink these herbs, come for acupuncture. That's the how. But if they don't get the why, it's really difficult for them to be motivated and to follow through on that. So what I want to do, because there are so many great talks on PCOS that I've attended, I want to give you my clinical pearls, and I want to tie into it my approach, because you will find as you work in reproductive health and you go to lectures and you gain your experience that you probably know a lot what I'm going to share today. Probably, I bet a lot of it won't be so new, but how I communicate, Ricky was talking about the language I use with the patients, the metaphors, so it lands, as Brenda was talking about, into the heart to give them hope so they get the why, so they get to do the how. And so I'm going to share that in my presentation, which I don't think you see in a lot of lectures. So that's where, like I could do my talk on how to treat PCOS, I just need 2 slides, which are in here. But I'm going to sandwich it with some stuff before and after, so you too will get the why behind the how, so you'll be inspired to use this in your practice as well. So I share when patients come in with PCOS, diagnosis, ovulatory disorders, I let them know that, my goal for you is healthy baby. And healthy baby equals healthy egg, plus healthy sperm, plus healthy uterine environment. My priority is healthy baby. However, some people will need things like IVF or donor eggs, and to me, that is the way to go if it's going to give us the healthy baby. Because at the end of the day, I want healthy baby, healthy mom, and if there's a man in the picture, healthy father. So we discussed the healthy baby approach. And I just want to start off with a case study that I'm going to talk about later on, but why I think this condition, when women are diagnosed with polycystic ovarian syndrome, why I think it's so important that they see people like us before they do ART, like IVF, superovulations, Clomid, letrozole. And it comes back to this healthy baby approach. We call it Jing in Chinese medicine, right? The healthy baby approach, we know epigenetically that the health of the egg and the sperm, those 3 months leading up to conception, the health of the man and the sperm impacts the health blueprint of the future child. The Jing, the essence. So this is why we want to work with them before. So I'm going to give you one of many cases I've seen in my practice with ovulatory disorders such as PCOS. Age 35. She had 5 ART cycles, ART assisted reproductive techniques. She did a Clomid cycle, ovulation drug, not successful. She did 2 medicated IUIs with Puragon, so superovulation. The same drugs they use for IVF, just at a lower dosage. Not successful. Then she did 2 IVFs. The first IVF, chemical pregnancy. Second IVF did not work. And I want to just share her response to the IVF. So her first IVF, 17 eggs retrieved. Out of the 17, 4 fertilized, 1 made it to blastocyst day 5, and that resulted in the chemical pregnancy that miscarried. Never made it to the heartbeat. Second IVF, she had 17 the first time, she had 13 fertilized, 4 fertilized in the first one. Second one, she had 13 fertilized. They did ICSI this time, injected the sperm into the egg. 3 made it to day 5 blastocyst. They transferred 2 on day 5, no pregnancy. 1 still on ice, 1 frozen. She comes to our clinic and says, I would like you to support me on my frozen embryo transfer. I'm hoping you can help me and create a receptive environment. Now, I'm going to continue this case later on in the lecture and tell you what happened. What I'm going to share with you is the discussion I had with this patient and why what we do can really benefit these women, give them hope, but educated hope, and why it's so important because our goal is healthy baby. You notice in these IVF cycles, lots of eggs, but not a lot of embryos. None making it to day 5. Why? The environment in which these follicles are maturing in is suboptimal because of the diagnosis of PCOS. A lot of them have this hormonal imbalance, so the environment is not optimal. So the egg is not reaching its peak fertility potential. And this highly androgenic male hormone-dominated environment in a lot of women with PCOS is not receptive to embryo implantation. So IVF is a great tool to get the egg and sperm together, but it doesn't do a lot or enough to improve egg quality, to get that egg to its peak fertility potential and uterine receptivity. And this is where we play integration. This is where we're a great tool together. So why we want to help these women? We want healthy baby, we want healthy mom. Look at some of the symptoms or conditions that women diagnosed with PCOS can develop when they're pregnant. Excessive weight gain during pregnancy, gestational diabetes, the baby's being large, so needing C-section, which can lead to other complications, pregnancy-induced hypertension, unfavorable lipid patterns, preeclampsia, which could be life-threatening, low bone density, increased incidence of type 2 diabetes, increased risk of cardiovascular disease. So we want healthy baby, healthy mom. Again, there's a role for ART. In this patient population, really, we are the primary, the first line of intervention that I would like to see for these women, because Clomid, letrozole, IVF is not going to do anything prevention for these kind of symptoms that we're seeing. So our approach in Chinese medicine is nourish the soil before you plant the seed. And so I alluded to this earlier, and we've talked about the soil a bit. Brenda mentioned it. I think Catherine mentioned it, Dr. Dow. And this is just an old Chinese saying, nourish the soil before you plant the seed. So a lot of our patients are going to come in and they're going to think that I just menstruated, so for the next 2 weeks, I got to be really healthy before I ovulate. Better stop smoking, eat well, exercise, stress reduction. But that recruitment, that egg that is going to be at its peak fertility at ovulation, it's not going to last those 2 weeks. It's actually a 1-year recruitment. And the last 100 days is when a lot of things happen to that follicle. It gets blood supply, receptors for FSH, and that's where it starts to grow from primordial follicle to an ovulatory follicle or a follicle that's going to get picked up in an IVF. And so really the last 4 months are really crucial in that soil of the environment. So I ask my patients, and I'll ask you guys, have you ever had a plant? This is how I get to the why, so they understand what we're going to do, because they're not going to learn, well, actually a lot of our patients are so educated, they know the Western already, but I don't see it's their responsibility to learn all the Western lingo or the Chinese medicine lingo. So I just use metaphors, and I like the garden one that the Chinese medicine has come up with. So I ask, have you ever had a plant that you neglected, that looked like it needed to go to the garbage, and somehow you added water to it, you moved it from the sunny window, and it regained its vigor and gave off fruits and flowers? Who here has had that, where you had a plant that looked like it wasn't right? So many people have done this. So did you change the roots? Did you give it donor eggs? Did you change the roots of that plant? No. You changed the soil. The plant always had the potential to give off fruits and flowers. But because the plant, its roots were in a suboptimal environment, it wasn't reaching its potential. My fertility patients, I can't tell whether you have good or not good eggs that can create life, but we can play with your soil. And if that soil is good and you have the potential to give life, that soil can help your eggs reach their peak fertility potential. And so this is how I explain this to the patients with PCOS or any fertility case. And so we go through this process of you're my garden and I'm your gardener. So we go through things that can affect your soil. So, you know, if the soil is dehydrated, we need to get blood flow to the soil, right? So we talked about the hypoxic, the lack of oxygen blood flow. We've heard this from a few speakers, right? Not getting oxygen or blood flow to a cell, which an egg is a cell, then it dies, right? As a woman ages, her blood flow to the reproductive system declines. And so there's breathing techniques to bring blood flow back into the reproductive system. Acupuncture has been demonstrated in some studies to increase blood flow to the reproductive system. So we want to help get blood flow to your reproductive system. Hey, what happens if your soil is deficient in certain nutrients? Well, we know the fruit then won't have those nutrients in it either. And sometimes you can't grow anything if you don't have selenium or the right nutrients in your soil. Hey, maybe you have deficiencies, nutritional deficiencies, vitamin D, zinc, selenium, magnesium. So we need to look around and see what you're deficient in. We can do this through symptoms, and we can also do this through actual testing. We can look. I used to be a CPA, so we call it the fertility audit in my clinic. We like to dig, right? So you get an audit from me, and this is the audit you want to have if you have fertility issues, right? We really check things where the clinics say that's nonsense. But we've had women that had just vitamin D deficiency that got corrected, and then they went on, after a failed IVF, went on and had babies naturally. So it can be really simple. The acidity, alkalinity of the soil. So this is the inflammation, right? If you have hormonal imbalances, the pH of the soil, hormonal imbalances, which women with PCOS most often do because of the blood sugar, the insulin issue, and also the high male hormones, the androgenic environment. So I go through this. We're going to pull the weeds out. You know, you have weeds or you contaminated soil or rock. So we're going to do some gentle detoxification. We're going to water your soil. So we're going to do things to bring water into your soil. We're going to give you nutrients to support the soil as well. Because if this soil is optimal, then your seed has the best chance to reach its peak potential and give off fruits and flowers. And we bring this into the egg cell. So if your egg has the environment, the right environment, it can reach its peak fertility potential. If you have the best seed and I put it in a sandbox, we don't get the great oak tree. But if we take that seed and we put it into really good soil that we cultivated beforehand, compost, pull out the weeds, add the fertilizer, add the water, protect it from the environment, then we get the great oak tree. And you don't have to know how everything works. If you put a tomato seed in a good soil, you don't get corn. You get tomato. It knows what to do. Same thing. We don't have to practice like Western medical doctors where they have to mimic the body at every level. It's really complicated to practice that medicine. We just create an environment that supports the body because we know the body has an innate ability to heal. We know that the body has the ability to self-regulate. And this ease comes when the body loses its ability to self-regulate. And so we just create the environment. After that, we don't have to worry about when FSH is being secreted, how much prolactin. The body just knows what to do, that autonomic nervous system. It learns to self-regulate again. So that's our role as practitioners, how I see it. And so looking through your soil, hormonal imbalances, these are things that are going to make the soil not so great. So these are things that you're auditing your patients, you're looking for. Do we see hormonal balances? You know, do they have acne? Do they go crazy before their period? Do you see other things that their cycles are irregular, like in PCOS, quite obvious. They'll have no periods or very delayed periods. Signs of nutritional deficiencies. You know, do you look at the fingernails? You see those little white spots on the nails? Like they know in the West, we know that's a sign of zinc deficiency, right? So we can look for certain things, right? Infections. So again, often in our medicine, that can be a damp heat, but just infections can affect the soil. Toxicity, it's everywhere. So, you know, I don't want my patients to become neurotic, but we educate them about the BPAs, not to microwave plastics, but it's all around us. So practices like breathing to help the body detoxify, gentle supplements to support the liver's function and detoxification, and just letting them know where some of these chemicals come from so they can avoid the ones that they're able to. Poor blood flow, a huge one that acupuncture is great for. Stress reduction techniques is great for. Digestive troubles, they could have the best diet, but if they're not absorbing, then they're not getting the benefit from their diet. And if they're not having good elimination, they're constipated, then they become toxic, right? That soil becomes toxic. So these are the things you're looking for when you look at their soil. When it comes to ovulatory disorders like PCOS, the first thing in Chinese medicine is to regulate this cycle. And so think about it with PCOS. If they're not ovulating, or rather than having 12 cycles in a year, they may be having 6 cycles because they're having 60-day cycles. So that decreases their chance of getting pregnant by 50%, right? Because they get 6 ovulations a year versus 12. So we regulate the cycle. And I wanted to give you an example of basal body temperature. In the earlier presentation, Catherine Anderson mentioned that a lot of the docs say dismiss that. And in my practice as well, the IVF clinics say, don't do BBT, it stresses you out. And I agree with that aspect of it if you're doing it to see if you ovulate. There's much easier, less stressful ways to confirm and predict your ovulation. As Chinese medicine practitioners, we like to look at patterns, we like to feel the pulse. So the BBT can become another pattern, another symptom that we look at to put into our Chinese medicine pattern. And also for patients, since a lot of us can't do blood draws and do hormonal testing, it's a way to see if we're helping regulate the cycle and balance the hormones. So again, this is a slide from one of Randine Lewis's talks, but I wanted to, it's not a PCOS patient, but this woman has an ovulation, she has high prolactin, she has, she's on antidepressants, and she has severe PMS. If you look at the first chart, it's zigzagging, right? So we don't see a biphasic curve. You know, we want to see it kind of low in the follicular and then a jump and then high in the luteal phase, in the second phase. Here you can't see it. And some practitioners will tell you this is a form of liver qi stagnation with depressive heat or maybe heart qi stagnation. You can study with people that really have taken the BBT, the basal body temperature, and turned it into ways to reframe it into Chinese medicine. So that chart is February. So the patient's doing acupuncture, stress, a lot of Qigong, Randine does Qigong, stress reduction, herbs. February, March, April, May. Now in May, the middle basal body chart you're looking at, same patient, you can see now there's a biphasic curve. It still's got a bit of that zigzag, still some stagnation going on, but you can see now we're getting a biphasic curve. This is pretty awesome because she's ovulating, right? This is nice. We're seeing an ovulation. Now the third chart, 2 more months later, now you have what I would call a textbook basal body chart where you see the low follicular, a nice quick jump, and now you see a high luteal, a nice biphasic BBT. So as a practitioner and for your patients, this is feedback of, hey, look what's happening. We're regulating your cycle because they're not pregnant yet. And often with our patients, they get frustrated, especially the ones diagnosed with PCOS, because they've been doing Clomid, they might have even done IVF like the case I'm going to talk more about. And you're like, look, it's been February to March, April, May, June, 5 months. And they're like, okay, I want you to give it 3 more months to conceive naturally. And they're like, are you crazy? I've been trying to conceive for 3 years and you want me to wait 3 more months? I go, you haven't been trying to conceive for 3 years. You've only been trying to conceive for like 2 months. How can you say that? And I go, well, you weren't ovulating before and your soil was so suboptimal. It's like, to use that analogy of hunting, you've been out with a gun hunting without bullets. You're really not going to get anything. I'm just giving you bullets. And so now we're starting. Now we see your cycle regulated. Now we're at ground zero. And at your age, you're supposed to do 6 months. I just want you to give it 3 more months because now every egg, the follicles that you have, the environment is optimal. Remember the 100 days? So if you do an IVF right now, then it's only been like a month of good soil, 2 weeks to a month. And I want the follicles that they pick up at an IVF, I want them to have 100 days. I want them to mature in that 100 days. That way, whether you conceive in the bedroom or in the lab, I know that they're at their peak fertility potential, that you've given them the right time. So we're a natural system. IVF is a great tool. Ovulation drugs are a great tool to force ovulation, but we're a natural system. So if I prepare my soil, going back to the garden analogy, and I make that soil perfect, compost, pull out the weeds, protect it, water, fertilizer, and I plant the tomato, I'm not expecting tomatoes the next day. It still has to go through the natural process and harvest in the fall. And so this is what I start to share with patients. Look how good you're doing. Look at your chart. Now, just to go through the Western diagnosis for polycystic ovarian syndrome real quick on the slide. So it's a syndrome. It's really neat. It's not like a disease. It's a syndrome. So kind of like Chinese medicine. They kind of like, here's a group of women and we're like, let's take these collections of symptoms and we'll call this PCOS. And so this is kind of one of the predominant diagnostic criteria. Not all the clinics go by this, but this is kind of the most common that they use. Do you have Delayed cycles or no cycles. That's what oligo-ovulation means. They're not regular, right? Delayed or anovulation, not having cycles. Do you have signs of androgen excess, clinically or biochemical? So the blood would be the biochemical. Clinically would be male pattern baldness, acne, hirsutism. Those are the kind of things that they would be looking for the male hormones. And then do you have a string of pearls on ultrasound? Do you see a lot of cystic ovaries? Now in my practice clinically, we see rarely the cystic ovaries. It's 1 in 2 that we see. And the protocol I'm going to share with you is for any ovulatory disorder. This is what I use, whether they call it PCOS or not, because the Chinese medicine practitioners doesn't really make a big difference to us. We're going to treat the individual, not the disease name, right? So we're going to look at all their symptoms there and come into a pattern. But I will share with you what I have found to be very beneficial for any ovulatory disorder. Again, talking to the patient, explaining the why, so they'll want to do the how. These are the symptoms that a lot of women have with PCOS, and these are the signs that you want to be looking for, because we actually help our patients get diagnosed with PCOS because they come to us not knowing why they're not getting pregnant, but nobody has really run enough testing to confirm or dispel PCOS. So when they start to come in with these signs and symptoms, we kind of think, do you have PCOS? And we ask them to run certain tests. But you can see here, trouble conceiving. So that's an obvious, if you're doing fertility, they'll come to your office. Excessive body hair growth, weight changes, and trouble losing weight. So the typical PCOS is overweight. That's the textbook. I will let you know myself clinically, my patient population are thin PCOS. So do not be fooled by thin women that are having ovulatory disorders and they fit the PCOS model, but they're not overweight. I see mostly thin PCOS. Ovarian cyst, low libido, cycles are irregular, being missed, male pattern baldness, thinning hair, the high testosterone levels, those are the male hormones, insulin resistance, tired, acne, mood changes, a lot of anxiety and depression, they're more susceptible to that, okay? So these are the symptoms that are PCOS, but it's a syndrome. Look at the signs. And then as we shared, you have to have 2 out of those 3 criteria I mentioned for a Western doctor to say you have PCOS. You don't get to get your chip that you have PCOS unless you have 2 out of those 3. So the approach that I want to share is an integrative approach, and this is the approach that we do at Acubalance. Community, this is huge. Like our acupuncture needles are great, our herbs are great, but there are other things that if they don't have them, we're temporary. There's a bigger picture, a very holistic picture that Brenda alluded to in her talk. So community, right? Your relationship with spouse, your work relationship, your relationship with friends, do you have that community? Do you feel supported? Why? Your autonomic nervous system. If you don't have that community, you don't feel safe and you'll be in fight or flight. You'll go into sympathetic overdrive, your brain waves will go into high beta. It's just built into us. Yoga and exercise. Do they have regular exercise? Are they moving the body? Following a low glycemic anti-inflammatory diet. We have a diet on our website. I wrote it many moons ago. It's called the Acubalance Fertility Diet. It's a low glycemic anti-inflammatory diet, and it's free for our patients. You can download it as well and share it with your patients. Herbs and supplements, meditation, nature. I would say I think meditation, and we have what we call Qigong. I personally always say, what do you see around the curve? Qigong is going to make a major comeback. Why? Because meditation is probably the best medicine out there, and Qigong is a form of it. So here's my approach. Real simple. Diet, I just mentioned them. Diet, exercise. I'm going to talk about acupuncture and supplements. I also use low-level laser therapy, and I use mind-body stress reduction tools in my patients. This is just a slide to show you that there's some research on acupuncture and PCOS, and it was this research that motivated me to start using the electrical acupuncture for our auditory disorders. So you have that slide to look at the research. Here's the approach and the protocol. So here's one of those 2 slides I said is my presentation. So the key here is dosage matters. You're not going to get much from once a week. They come 4 times a week, right? But this is what works to regulate the cycle. Once their cycle starts to happen, or usually after 12 weeks, we want a minimum of 8, but after 12 weeks, then we'll bring it down to twice a week. And we won't do EA, electrical acupuncture, in the luteal phase. once they have a regular cycle. At the beginning, we do it throughout the cycle. So that's our approach for the acupuncture part of it. These points, stomach 29 bilateral with 2 hertz, spleen 6 to spleen 9, 2 hertz, and then everything else is pattern-based. It's outside the scope of today's talk, but we use low-level laser therapy in our practice. So often we don't do the stomach points anymore because we're using low-level laser therapy. It's been shown to increase blood flow to the reproductive system. It's been shown to reduce oxidative stress, which Catherine talked about earlier, improve mitochondrial function on a cellular level, and regulate inflammation, right, which is major for all health issues. Here's my supplement protocol. So let's talk about the inositols, N-acetylcysteine, liver detoxifiers, vitamin D3, magnesium bisglycinate, CoQ10, and prenatal. All my PCOS patients get pretty much this. We also always test their vitamin D3, and we also always do a thyroid panel. So many of my ovulatory patients with issues have a vitamin D or a thyroid issue. In Canada, it's social medicine, so it's free, but they only test TSH. And if you have a lot of the symptoms, they may test T4, but they don't test free T3 or the antibodies very often. It's hard to get that. You have to make a good case. We are not covered, and so for our patients, they pay out of pocket for the test. It's a relatively inexpensive blood test, but we do TSH, free T3, free T4, and the antibodies. We've uncovered many Hashimoto cases through this that haven't really presented as symptoms, except for infertility and ovulatory disorders through our blood work. Here's the supplements and why. So inositol powder, it regulates insulin. Some say you want to have a ratio of 40:1 of myo-inositol to D-chiroinositol. In our clinic, often we use 4 grams of myo-inositol. There is a company in the States, Theralogics, that does a ratio of 40:1. We use ester support by AOR, but basically it's just to help the liver. There's an expression, happy liver or healthy liver, happy menstrual cycle. It has calcium declarate in it. It has DIM in it and a few other hops, a few other things to support the liver. NAC, N-acetylcysteine, I'm going to talk about it. It's one of the most important supplements I use for my fertility patients. We put them on vitamin D and K. We usually start them at 2,000 international units. Once we get their results back, depending where it is, we will usually increase it if it's low. And the range in conventional medicine is here, and we practice with functional medicine in our clinic as well. Our range is a little tighter because the range is more about disease. I feel like crap, but I'm alive. I can get out of my bed. And Chinese medicine, functional medicine is vitality. I wake up, I'm excited, I feel great. So their low normal is too low for what we want for vitality. It's okay that you won't die from this range, but you're going to feel like crap and be infertile. We're looking for da-da-da-da. So CoQ10, PQQ, again, a great antioxidant. It's been shown in mice and in human studies to help with egg quality. Magnesium bisglycinate helps maintain a healthy pregnancy. It has its role in glucose and insulin regulation. The adrenals love it, so it's a supplement that many people are deficient in, so it's kind of like one of the standards that we like to give at our practice. And then the essential fatty acids most people know about. N-acetylcysteine, just studies show that it can improve levels of circulating insulin in your bloodstream. Important factor for women with polycystic ovarian syndrome. I like it because it supports the liver and detoxification, and it's been shown to help regulate inflammation. So many diseases are related to inflammation, which in the scientific community they also call inflammaging. And inflammaging is accelerated biological aging that leads to premature degenerative diseases, and I say premature fertility decline. So anything that's going to help regulate inflammation is going to help slow down that accelerated biological aging. They may be chronologically 40, but biologically they may be 50. And through diet, lifestyle, stress reduction, acupuncture herbs, and acetylcysteine, we can bring down their biological age to 40 as well. And 40-year young women can get pregnant. If you've seen that movie, My Big Fat Greek Wedding, remember the grandfather, Windex? NAC is my Windex. Everybody gets NAC, right? It fixes everything. Let's go back to this case. So remember, 35, right? She's age 35. Let's go here. I want to give you some of her signs and symptoms. So she's done 1 Clomid, 2 IVFs, and 2 superovulations. No success. She has a frozen cycle. She wants me to help with the uterine lining, receptivity. So I gave her the spiel about reaching the peak fertility potential, having that 100 days. And I said, this, because the high androgenic environment can make your uterus less receptive to implantation, to that embryo. And I said, now that she got it, that embryo was made in that soil that wasn't so optimal that you have on ice. What I'd like to do, and I encourage you, is give us about 100 days, give us 4 months, 3 to 4 months to work with your cycle. Let's see if we can regulate your cycle. And if we see your cycle regulated, then maybe you want to try naturally, and you can keep that other embryo for later. And if not, if you're not pregnant, then you can go back and try that embryo. She was 185 pounds, BMI of 29. She was only 5'6". She was overweight. She doesn't get periods. She only gets periods when she's put on progesterone or does a Clomid cycle, right? So she doesn't get periods. She suffered from fatigue. She had constant bloating, poor digestion, food cravings, mild depression, hirsutism, poor sleep, cystic acne, okay? What I want to share with you is 3 months into the treatment, her acne's gone. Lost 25 pounds. No longer bloating. No longer depressed. And she could tell that the hirsutism was changing. And she said, I don't think it's working. Because she hadn't had a period yet, right? She doesn't have a cycle. And so I want to share this metaphor with you because this is really powerful for anything with our patients, this analogy. Because of course they get frustrated. Brenda shared with this. They've just been inundated and they don't know who to believe. Everybody's promising them and nobody's getting them anything. That's why they're seeing you. They're not pregnant yet. So you got to put yourself in their shoes, right? And so I just said, you know how you cultivate the soil before you plant the seed? We talked about this. Yes, I get this. So we've been cultivating your soil and you planted the seed. Do you know what happens under that soil against the crazy odds? There's amazing things happening. But after you plant that seed, after a month of working on the soil, you plant the seed and you come back to the soil and you look and you're like, nothing. I think this might have been a waste. All right, I'm gonna add some water, add a little fertilizer. You come back 2 days later and you're like, damn, nothing. So on the surface, on this picture here, you see nothing. But underneath, something amazing is happening. The seed starts to decompose, it sprouts. And against crazy odds, no light, very poor oxygen, incredible weight, this little fragile sprout starts to grow up against the dirt. But on the surface, you're like, I don't think anything's happening. But underneath, amazing things are happening. This is the most of our patients. They don't see anything, but underneath things are happening. Now, what I shared with her, I go, you're not there. You're like that sprout over here. Your hirsutism is reduced. You lost 25 pounds. You don't have acne anymore. You're not depressed. You have energy again. You're not bloating. You don't have tomatoes on your plant, but you can see the plant is there. You want to keep watering this plant. She goes, you're right, I do. Because she was ready to quit, saying it's not working. I'm done. I haven't had a period yet. So we treated her for another month, and she conceived naturally. And as to March 30th, she's 39 weeks pregnant. Clomid, so this is what we do. This is our medicine. Clomid, nothing. Superovulation, nothing. Superovulation, nothing. IVF, one embryo to transfer, chemical pregnancy miscarry. Why? Maybe the embryo wasn't great quality. Maybe the uterine environment wasn't receptive. Probably both. Next IVF, nothing. ICSI, thousands of dollars, all these drugs, nothing. Why? Because it can't prepare the soil like we do. It can't help the gene to reach its peak fertility potential. And this analogy that I share with the dirt, please use this with your patients because they get this. They can understand this idea, okay? So I wanted to share that with you. So in summary, yeah.
Just to clarify, was it a transfer or was it natural?
The question is, was this a natural pregnancy or a transfer? This was natural. That embryo is still on ice in the lab. She's 39 weeks pregnant, okay? It was natural. And this is not like, anecdotal, one case. I know colleagues that do this all the time with PCOS. I know we do this all the time. But we prepared the soil. And you know what? A lot of those patients get pregnant. And our goal is healthy baby approach. Randine shares this a lot, and she's been sharing this with me since I've known her since 2000. It just started sinking in. We're so focused on pregnancy, but really we want to be focused on healthy human being. and healthy baby. That's our focus, right? We want to create healthy babies. Nobody's going into this knowing that if they do this, they're going to have a very sick child. I don't think they would do it if that was the idea. So just reminding you, our goal is to help them reach their peak fertility potential. And we do this by preparing the soil, right? Cultivating the soil. Healthy egg plus healthy sperm plus healthy uterine environment. And this is how we help people reach their peak fertility potential. This is the medicine we use. Diet, lifestyle. I put the important stuff up front. You notice that? Diet and lifestyle. You come for acupuncture herbs and don't do the diet and lifestyle, then I think we're missing the boat. This is important. Acupuncture, supplements, herbs. We use the photobiomodulation laser. And I think Qigong and meditation, this has been where my personal journey is. So for me, it's all been conscious awareness, meditation, self-cultivation. And I'm just learning and finding practitioners of our medicine that have practices that we lost in the Cultural Revolution, that we don't get taught, but exist in our medicine to help you connect to that field, to that source where miracles happen, miracles. So we often, Western medicine and even the way we practice, we're trying to change matter using matter. We're using our needles in a very Newtonian 3D way. But the medicine has a way of using energy to change matter. And when you use energy to change matter, it can be a spontaneous healing that fast. And I'm looking for practitioners that will teach us in that way now, because I think that's what the paradigm shift is happening. I think that's where we're going. And that's why I think meditation, Qigong, and those kind of practices are what's going to shift humanity and healthcare. So remember, nourish the soul before you plant the seed.